Hey guys, welcome back to Simi Refresh video of our channel. Today we're gonna learn about the pharmacology of C.H.F. Well, before discussing the whole of the pharmacology, let me tell you what are the basics of C.H.F. so that we can derive pharmacology from basic itself. Actually, C.H.F. is a condition in which heart is unable to do its assigned task. I mean to say that heart is failed to meet the metabolic demand of the body, or similarly we can say that it is a pump failure which results in the buildup of fluid. The term heart failure can also be used to represent this condition as it doesn't necessarily associate it with the fluid overload. Now let's check out the basic working of the heart. How exactly blood moves from the body to the heart or from heart to the body. Actually, inferior and superior vena cava pour the deoxygenated blood from the upper and the lower part of the body to the right auricle. Then it moves towards the right ventricle, and from that right ventricle, deoxygenated blood moves toward the right ventricle to the lungs through the pulmonary artery. Now lungs will make it oxygenated from deoxygenated blood. Afterwards, oxygenated blood will move towards the left auricle with the help of pulmonary veins. Then blood moves towards the left ventricle, and from the left ventricle it will distribute towards the whole part of the body with the help of aorta, which is the largest artery of the body. Now let's check out the various type of C.H.F. with the help of simple diagram. At first we are going to concentrate on the left hand side of the heart. If the left ventricle cannot pump adequate amount of the blood through the aorta to the peripheral circulation, a part of it is retained in the left ventricle during systole. Because of this accumulation, left ventricle unable to accept blood from the left atrium, which in turn from lungs. Hence, C.H.F. in left ventricle always lead to pulmonary congestion. I mean to say it will lead to accumulation of fluid in the lungs. Similarly, on the right side of the heart, when the blood cannot pump from the right ventricle into the lungs, a part of it is retained in the right ventricle. Because of this accumulation, the right ventricle will unable to accept blood from the right auricle, which in turn from the inferior and superior vena cava. Hence, right-sided C.H.F. always lead to peripheral edema. Remember, right-sided C.H.F. always lead to peripheral edema, and the left-sided C.H.F. always lead to pulmonary edema or pulmonary congestion. And the most common type of congestive heart failure is left-sided C.H.F., which is categorized further into two types. First one is the systolic dysfunction, and the second one is the diastolic dysfunction. Now let's check out the reason behind the systolic and the diastolic dysfunction. Systolic dysfunction, as the name suggests, occurs when the ventricle fails to contract normally. This is due to the reduced level of force of contraction when the ventricle fails to develop sufficient wall tension. And the wall tension can be defined as the multiplication of intraventricular pressure into ventricular radius. And the diastolic dysfunction occurs when the muscles in the left ventricle become stiff or the wall becomes thickened, due to which the ventricle unable to relax normally during the diastole. As a result, it can no longer relax. The heart cannot fill with blood between the beats, which will ultimately result in the problem of C.H.F. We are going to see about the symptom associated with the problem of congestive heart failure. As you already know that the lungs get congested with the fluid. It will eventually lead to three symptoms. First one is the shortness of breath, second one is the dry cough, and third one is the wheezing. And the second one is the fluid and water retention, which occurs due to the low cardiac output, which ultimately results in the swollen legs edema, or weight gain. Low cardiac output also results in the less perfusion to the organ and muscles. Less perfusion of blood also causes less oxygen, which results in the dizziness, weakness, or fatigue. And the symptoms associated with the GIT tract in the problem of C.H.F. are: first one is the bloating, second one is the nausea, and third one is the loss of appetite. And we discuss over the problem or symptoms regarding the CVS cardiovascular system. Rapid or irregular heartbeat may occur. This is due to the compensatory mechanism, which causes the heartbeat to faster to pump enough blood to the body, causing rapid or irregular heartbeat in case of low cardiac output.